All right, so in this case study, the patient presented with symptoms of abdominal pain, particularly in the right upper quadrant, fever, discoloration of sclera, and skin. This gives us important information about damage to the liver because we know liver anatomically located in the right upper quadrant. Generally, the liver stores excess glucose in the form of glycogen and an excess amount of fat in little quantities. So we can say that liver is a storehouse, but due to consumption of alcohol, the metabolism pattern is impaired. And liver alcohol is degraded into aldehyde form due to the presence of alcohol dehydrogenase, and the produced aldehyde gets degenerated into acid form due to the action of aldehyde dehydrogenase. This acid was excreted from the body when it was in limited quantities, but when there is over drinking, there will be more acid production. This more acid leads to the acidic medium, which makes the cells to inflammate. So in alcohol overusage, we can see cirrhosis of the liver. This means that there will be overaccumulation of fat, which gives a greasy appearance to the liver. Initially, in the liver, there will be architect cells, but in alcohol overconsumption, this architect was damaged, which leads to the formation of micronodules. During later stage of these micronodules to form macronodules. Later, these macronodules will degrade to form a lesion like this is called cirrhosis of the liver. As there is development of nodular masses and distortion of normal anatomy of liver, there'll be compression of bile duct and gallbladder. Due to this compression, the bile cannot get eliminated into gastrointestinal tract, so the excess amount of bilirubin is entered into blood. So due to the presence of bilirubin in the blood than the normal limit, it leads to discoloration of skin and sclera of eye. The discoloration occurs due to the deposition of bilirubin in the collagen fibers. So the treatment choice, alcohol must be quitted and motivate the person to quit. If not, then try with medications like, what is it called? Acromesonate, I believe it's called. Second thing, anti-inflammatory drugs must prescribe to control the inflammation of liver. And then as the bile was not eliminating, it was the major source of cholesterol excretion. So the cholesterol level must be regulated with anti-hyperlipidemic drugs like statins and fibrates. So as the liver was damaged, there will be inadequate synthesis of album clotting factors, so the patient must be under control, preventing from injuries, and to avoid bleeding, lost caution must be taken. So in most cases of alcohol hepatic toxicity, we need to give thiamine. So this is to prevent rancos and encephalopathy, I believe it's called, which occurs due to over drinking. So we also need to regulate the blood glucose levels, and then if the liver was damaged severely, then possibly go for a liver transplant.